Well, good morning or good afternoon, everybody, depending on where you're listening from. My name's Arthur Brandwood. I'm the founder and principal consultant at Brandwood Biomedical, and welcome to this May edition of our Brandwood Live webinar. Today, we're going to look east. We're going to do an update on China. I have here with me in our Sydney office, visiting from Beijing, the senior consultant from our Beijing office, Jeff Sun. Jeff's been working in this industry for a very long time, for at least 20 years, I think, working in Beijing, principally for the China offices of major US multinationals. And so he's very familiar with how the CFDA operates and how they tend to continue to modify regulations and build on what's going on over there. Now, 2 years ago, CFDA published Order 650 and the Decree 650. The changes there were far-reaching. It replaced the old Order 276 and really turned regulation on its head in China. Some of the biggest changes included resetting the requirements for clinical trials. So now many more devices require clinical trials. And when those trials are required, they have to be done in China. So more manufacturers are doing trials in China. Classification regulations have been revamped. Class 1 devices are now notification only. That sounds simpler, but you actually have to hand in a whole lot of technical information with that notification. So it's still something you've got to be very careful about. And the CFDA processes for submissions are seeing continuing adjustment. So, Jeff, welcome. Yep. Welcome to Sydney.
Thank you.
I'm interested to hear about it. So a lot's changed in the last 2 years, and this is continuing. So what's happening in China now? Maybe we can start with the subject of money. I did hear that there was an announcement on a separate industry website. I think the ministry, the industry ministry, saying that they were reducing a whole lot of administrative fees, and it was a curious announcement. It had things like there will no longer be fees for water extraction from the Yangtze River and all sorts of stuff like that. But amongst that long list was a little item which said no more testing fees for medical devices. What's that about?
Yes, and actually from the April 1st and this year, the CFDA registration testing fee is waived, but the testing house rely on the fee revenue to fund their operations and things like technician bonus for performance targets. So the removal of the fees have had some surprising effects. For example, some testing houses do not accept a new testing assignment for the time being, and some testing houses only accept new assignments from companies within their provinces. And the most important is that some CFDA testing houses have asked the manufacturer to guarantee their products will pass CFDA in testing. And in the past, you could just the design, negotiate, change in protocol. But now, and when there's a failure in testing, the testing house will directly issue a non-conformity report and reject the testing.
Wow. So let me understand that. So previously, you could, my experience of going through type testing is you'd submit the device to the test center, you negotiate the protocol, and then the testing would proceed. And if you ran up against a problem, you could figure it out. You could modify the protocol or have a concession, or maybe adjust the device, make a late change in the design so that you could get through the testing. You can't do that anymore, you say. So now they're not getting paid, so there's no money for the engineer incentives, etc. So they're just going to do, there's less incentive to do all the extra things, so they're now just going to test, and if it fails, it fails.
Yes, correct.
And the consequence is you go back to the beginning.
Yes, so if the manufacturers now want to redo the test, then it has to go back to the end of the queue. And this will no doubt seriously increase the testing time cost. And another the trend is previously the testing contract between manufacturer and the testing house is fixed. It stipulates the general time for different type of testing. And now, with the new testing fee regulation, and the contract would become non-fixed terms.
So because there's no money to pay the engineers the bonuses for the performance.
There's
no longer a commitment to a delivery.
Yeah, they cannot guarantee the finishing time
so
of the
things
test.
are going to get slower.
Yeah.
That sounds difficult. So what should we do? What can manufacturers do to control these risks?
Yes, and under these conditions, that the manufacturer can consider some alternatives. For example, if a manufacturer could afford the budget, and they can consider to do a preliminary test assignment in CFDA testing house first. And this will require a fee payment to the CFDA testing house like before, but the test will be informal and not official. Then, if the preliminary test is okay, and then the manufacturer can request a retest under the formal type testing process. And although that this pathway, it will raise some additional cost, but it will definitely shorten the testing time cost if they can pass registration testing one cycle.
That sounds like a very Chinese arrangement, if I may say so. So there are no longer formal test fees, but now you can pay you might be able to pay an informal test fee. I don't mean an informal payment. I mean you'll contract the lab to do a preliminary test where you do the dry run, you check that everything works. And then when you've gone through that, you then go through the regulatory testing process, for which there is no fee. So you'll still end up paying a fee, and you'll do a pre-test if you like to confirm everything works. Then you do the formal. Okay, so a very imaginative adaptation to the change in regulation. So you're still gonna end up paying fees if you want to make sure that things work.
Yes, correct. And actually, the manufacturer would prefer this pathway, because that for the whole registration in China, the time cost is the most indeed and important, and they can consideration. Correct. And the other is that if the device is complicated and advanced or large scale, and the manufacturer could consider inviting the testing engineer to go to their plant for on-site testing.
So a complex medical device, complex piece of electromedical equipment, or something big like a large diagnostic imaging equipment, you can't send a machine to the test lab, so you get them to come to you.
Yeah, because delivery of the large-scale medical device to China will much time cost. Correct.
Okay.
And or the manufacturer could send their own engineer to the CFDA testing house to monitor the whole process, and the manufacturer and engineer could work together with the CFDA testing engineer and to solve problems on site. And this would also be a efficient way that the manufacturer could consider.
Okay. So you can send your own engineer, and they can work on. Can they participate in the testing? That's how it works, isn't it? The engineer actually participates in the actual test activity, sort of under the supervision of the CFDA test centers engineer. So
correct.
They can help out. They know the equipment, and they can
because sometimes the CFDA testing engineer, they do not quite know about the medical device manufacturer.
And I can imagine if your engineer is there, then you're going to get more attention than the device that's just sitting on the shelf without an engineer there.
Correct.
Okay, thank you. Okay, interesting. Okay, so type testing is obviously a critical step, but what else is happening? So I heard that the CFDA has updated its recall process very recently.
For the May 1st, and the CFDA implemented a new medical device and recall regulation, and now it's a requirement that for imported medical device, a recall which happens even outside of China must be reported to the CFDA, and this haven't been necessary before. And the CFDA now will be actively and watching what happens outside of China, and may want to extend the recall activities within China.
So this is actually very similar to what already happens in markets like the United States or here in Australia, where the agencies in fact require you to tell them that if you have a recall activity or significant post-market activity on a medical device, that's supplied in one of those markets. So the action might take place here in Australia, but if it's supplied in the United States, you have to tell the FDA, and you might have to go through the recall process there.
Correct. Yeah.
Now China's doing the same thing. They're watching,
yeah.
and they haven't previously done that. But now they're also really actively watching what goes on internationally. So be prepared to extend your recall activities into China more frequently from now on. That's interesting. But the China recall pathways are well established. They've got the same sort of formal recall and tracking and audit processes that happen everywhere else. Okay. So we're seeing things changing in both pre-market and post-market regulation medical devices. I do want to show a picture here. This is last year in Chengdu at the China International Medical Device Regulatory Forum. This gentleman, Wang Langming, one of the senior directors at CFDA, was talking about how CFDA were trying to change their processes, and he talked about all sorts of things like administrative reviews and better quality and whatnot, but particularly about targeting particular device types, innovative devices, and priority devices for particular clinical needs. So we are seeing these sort of fast-track pathways, if they are fast-track, and obviously there's a great deal of interest in those, and everybody, innovation is the buzzword of the hour. Of course, everybody's device is innovative, but there's some new guidelines come out. So what can you tell us about what's going on with these new pathways and what guidelines are current?
Actually, that in the last December, the CFDA published guidelines for the preparation of registration documents for innovative medical device. Then, in February this year, CFDA published a guideline for the preparation of registration documents for priority approval medical device.
So there are two different pathways: innovative devices and priority devices.
Yes.
And so then what happened? So those are the new guidances. Many manufacturers are sort of excited about this, but what's really going on? Is this working?
Yes, and with the innovative and priority pathway implemented, many manufacturers are excited about faster registration and looking to use these shortcuts for their devices. But actually, the final approval rate is very low. For example, there are about 200 innovative projects were submitted in the year 2016, but only 44 projects were approved, and only 5 projects were from overseas. So for the priority pathway, the submitted and approval cases are even much less. And the reason for these challenges are to do with the preconditions for innovative and priority pathways. For example, it is very hard to pass the innovative evaluation if the device without holding China innovative patents. And
let me just understand that. So it's a prerequisite. You have to have a China patent to enter the innovative pathway.
Yes, correct.
So that's important. And of course, IP protection is a common subject. We're going to talk about that today. But setting a China patent is important for this reason as well, if you want to go down this pathway.
Correct. And if the device does not has a very obvious and clear clinical advantage, or is not listed as the national or provincial key research and development plan, it is hard to pass the priority evaluation and go to priority pathway.
Okay. So just let me understand that as well. The part of this is really China industry development, isn't it? So one way into these pathways is if your device speaks to a provincial industry development target, all the provinces are looking to develop certain capabilities, and if you fit into one of those, then you qualify. So it's a way of supporting local innovation.
Correct. And also it's important to understand that to enter the innovative pathway, it is essential for a clinical trial on the device to be performed in China. If you use the conventional pathway, it may be possible to provide a literature and a predicate-based clinical evaluation report and avoid the clinical trial.
So you're innovative, therefore you're new, therefore we must do a clinical trial.
Yes, because it
okay,
so
that's one thing to be very aware of. If you're going to go down this pathway, you will have to do an in-China clinical trial.
Yeah.
No choice about that.
Yeah.
Okay, so every coin's got two sides.
Yeah.
Okay, so and the manufacturers really need to go think about this and look at that. Okay.
Yeah.
Thanks, Jeff. So nothing is really as ever simple as it seems, especially in China. Look, last of all, I want to come on to one other thing. It seems that CFDA, as was said by Wang Laming, is really trying to streamline some of the administrative processes. We saw the introduction of the Class 1 notifications to stop reviews of low-risk devices and an administrative process put in place there. And now I understand that the Center for Medical Device Evaluation, which is the division of CFDA that actually does the technical reviews, is now going to take on part of the administrative review as well. Up till now, what you have to do is you go through the Center for Medical Device Evaluation review, and then after that, the application, the file goes back to CFDA headquarters, and they do a further, what they call an administrative review, but really it's a final last check that everything's correct, and that adds extra time. Now that's all going to be done in CMDE, and CMDE will issue the approvals directly for some types of. So tell us a bit more about that.
Yes, and from July 1st and this year, and for some applications, the Center of Medical Device Evaluation will start to do the final administrative process itself. And the registration will no longer need to go back to CFDA for administration review.
Okay, and that review takes 4 weeks, 6 weeks, something like that, sometimes 2 months.
Yeah, originally,
so potentially say a couple months. Is that for everything, all registrations?
This change concerns and only to the change registration for imported device and all license renewals. For these two kinds of registration.
So it's not for everything. So they're starting with just the updates and changes to existing registrations.
Correct.
Hopefully this is a trial, and then they'll extend it further in the future. Okay. Let's be interested. It'd be interesting. So to save time, they're doing it at CMDA. We'll have to see how much time that actually saves.
And after all, in the past, there was almost never a rejection by CFDA once the review has passed the CMD review. So to save time, the administrative process will now be handled directly by CMDE. By this upcoming new regulation, we will see and whether it can still be so smoothly applied.
So there's been a recognition that the supplementary headquarters review wasn't adding really much value. They weren't changing the decision, so they let the decision take place earlier in the process. Okay, I think that's all we have time for on the current issues. That's been a fascinating discussion. Now I think we've got some questions. I'm just going to have a look at what we've got here in terms of questions. Now, I have a question here from Cynthia, which says, what about special equipment to do testing that's only at the facility of the manufacturer? Does the manufacturer accept outside test results? So if you've got an unusual piece of equipment, device that requires specialist test equipment that the type test center doesn't have, how does that work?
And by current CFDA regulation, that if some medical device do not list at the CFDA testing house list, you must to apply for a new application to the CFDA, and the CFDA will designate specific testing house to do the test.
Okay. Oh, sorry. I understand. I'm not sure that's quite what Cynthia's asking about here. What she's saying is that if the device is unusual and the testing house doesn't have the equipment to make the test to do the test.
Yeah, okay.
Because of the nature of the device.
Okay.
Presumably that then comes to, the testing engineer can come to your facility.
Yeah,
and
correct.
Test it in your
Yeah,
house.
correct. Yeah.
But it's still got to be done by the test house. You can't just go and get a third party and give them the data.
No.
The CFDA test house has to have control of that testing.
Control testing, and they will designate the specific.
Okay. Katie says, what are we talking about with the green flag pathway? Is that the innovative pathway or the priority review? People talk about the green channel.
Green channel.
Green channel is the innovative device pathway, I think, usually is what we're talking
about. The green channel is actually to include the innovative pathway and the priority pathway.
Both.
Both.
So it's a common. The green light, you're going to go through more.
Correct.
Okay. Thank you. And we have a question from Leanne who says, pre-testing or during official type testing? I'm not quite sure what the question's about, but let's just look again at that. So I'd just like to understand that as well. So CFDA currently, what happens now is that you pay a fee to the type testing center.
Correct.
And they do the test, and there's a fair bit of scope for adjustments as you go along and negotiation. There's a technical challenge. Some test centers allow you to pay a bigger fee and things to go more quickly. In other words, an express processing charge.
Expedite fee.
Now they're not allowed to charge fees, so you've got to lose the express way, and also the engineers who are get paid bonuses and so on for performing those incentive payments are going to disappear. So really, doing a pre-test is a way of getting the attention of the test center and getting things lined up quickly. Well, just a separate question. I did hear that one of the things that's happening is because of the likely disappearance of their bonus schemes. I get that some of the test centers are losing their engineers.
Correct.
To leave.
A lot
also causes some problems.
A lot of resources is
Okay. I have another question from David, who says, can you tell us a bit more about the application process for the innovative device pathway? Because there is a separate pre-application that takes time, doesn't it? How does that work?
And generally the whole and the process will be the submission, and the CFDA will have a special committee to evaluate the innovative and documents or the priority documents, and then there will be a public notification in the CFDA website, and the final, if all the smoothly, and the final will go to the technical evaluation process, and this is the general process.
So this takes a bit of time. How long does it take to do that pre-qualification part?
Maybe that 2 months around.
So maybe a couple of months up front.
Up front.
To qualify. But then once you do qualify, you get a lot of special treatments. You can do the classification. In parallel, you get somebody on the inside who's going to make sure your application gets looked after, that sort of thing. So when the qualification is okay, and then we'll go to the technical evaluation. The advantage is you do not have to wait the queue for the technical evaluation, and they will put your products. So you start to jump to the top of the queue once you're in. So if you truly have an innovative product, you're going to have to do a clinical trial anyway. It really might be worth doing this.
Yes, correct.
So now Leanne's just clarified her question. Thank you, Leanne. She says what she meant was, can you send an engineer to the test house only during that pre-testing or during the formal testing as well?
I think this is depending on the manufacturer's choice. And
so it's possible if you want to do that, you can have your engineer present through the whole process.
The whole process is okay.
And it's probably really important in that last formal bit, so that if something does unexpectedly go wrong there, somebody's on the spot to try and fix it before they issue the non-conformance.
Correct.
Okay. Alrighty. Maybe let's see, one more question. Just a clarification. George says, can you just clarify this idea of transferring the administrative step to the CMDA? How much time will that really save? So we talked about that briefly.
Yep.
Currently, it takes how long? Once the CMDA has finished its technical review, they send the file back to CFDA headquarters. How long does that administrative review take?
And I think that usually will be under 4 to 5 weeks.
4 to 5 weeks.
Yeah.
What do they do? What are they checking again?
Yeah. Because I think that they just to do for formality and the check. So
they will making sure everything.
everything's right.
All the test reports are there, and that takes about 1 to 2 months. And so hopefully. If CMDA are making sure it's all good as it goes through, they don't have to do that final step. So that's what we're looking to say. Okay, thank you. We're coming up to the half hour, to the end of our time. Jeff, this has been a fascinating discussion. Thank you so much. Thanks again for listening, and come back and join us next month. Bye-bye for now.